How often should patients with colon dysplasia have colonoscopies? Have you ever wondered how often someone with colon dysplasia should get a colonoscopy? Colon dysplasia means there are abnormal changes in the cells lining the colon. These changes can be precancerous, which is why monitoring is crucial. The frequency of colonoscopies for patients with colon dysplasia depends on how severe the dysplasia is and other personal risk factors. For patients with low-grade dysplasia, doctors usually recommend a colonoscopy every 1 to 3 years. This schedule helps keep an eye on any changes that might lead to high-grade dysplasia or cancer. It also helps avoid unnecessary procedures. On the other hand, if a patient has high-grade dysplasia, more frequent colonoscopies are necessary. Initially, these may be scheduled every 3 to 6 months until the dysplastic area is treated or removed. Once the colon is clear of lesions, the intervals can be extended, but they will still be more frequent than for those without dysplasia. If a patient has multiple or large adenomatous polyps, especially 10 or more that appear over time, annual colonoscopies are recommended. This approach is vital until all lesions larger than 5 millimeters are removed. This careful monitoring helps catch any potential progression to cancer early. Several factors can influence how often a patient needs a colonoscopy. A history of adenoma removal increases the risk and may require closer follow-up. Additionally, if a patient has inflammatory bowel disease, this can raise the risk of dysplasia and affect how often they should be monitored. Patient health status and other medical conditions also play a role. The main goal of these surveillance colonoscopies is to detect and remove precancerous lesions early. This proactive approach is crucial in preventing the development of colorectal cancer. Each patient's situation is unique, so it is essential for individuals with colon dysplasia to consult their gastroenterologist or colorectal specialist. They can help determine the best surveillance schedule tailored to the patient's specific condition. Regular follow-up and sticking to the recommended colonoscopy intervals are key to managing colon health and preventing cancer effectively.